Good evening, everyone. The plan is to reduce the number of people who become addicted and then turn to heroin.
But will it work? Anjanette Levy is here with what those who treat addicts are saying. Anjanette.
Well, Rob, addiction specialists will tell you that some heroin users become addicted by first using pain medication that was prescribed to them. Those people who work with addicts say these prescription limits are a good thing, but they're also a very small piece in what's a large and complicated puzzle.
You are going to have to abide by these rules, and if you don't, you're going to be in serious trouble.
A stern warning from Governor Kasich to doctors prescribing opiates. Under the new limits, doctors cannot prescribe opiates to adults for more than 7 days and 5 days for minors. Doctors must also provide a reason for prescribing the drug in the patient's record, and a diagnosis must be entered into Ohio's prescription monitoring program.
It doesn't in any way, shape, or form address the current demand for opioids, illicit or prescribed.
Dr. Shawn Ryan treats heroin addicts at his Brightview clinic. While the number of opiates prescribed in Ohio has been reduced, Dr. Ryan says overdose deaths have increased, as this graph shows. Nan Franks of the Addiction Services Council is also concerned that the bill doesn't address treatment, and there are other concerns.
As we dry up this one avenue of getting pain pills, which is great, but that the business of drug sales on this street will shift to more what's called street initiation.
The crime lab has already found fentanyl in some cocaine in Hamilton County. To those working in the trenches with addicts, they say they will benefit from more access to treatment.
Just way too many Ohioans who are currently dependent or addicted to opioids, and to address that, it has to be treatment. It can't be just a reduction in the prescribing.
And providing more treatment, of course, costs a lot of money. These new guidelines do not impact doctors who are prescribing pain medication for cancer patients or those people who may be in hospice. It also doesn't impact patients who are receiving medically assisted treatment for addiction. Rob?
Anjanette, thanks very much. To see more of our stories on the heroin epidemic and learn about places you can go for help, visit our Hooked on Heroin section on local12.com.